flew to Cleveland last Friday, and out of LaGuardia, and I had a mask and everything, and I flew back through JFK on Monday. Last 2 days I've been feeling really sick. I think it's just the flu. I've had really bad shortness of breath, extreme fatigue, like to the point where no matter how much sleep I get or coffee I drink, I'm just super out of it. I've had chest pain, slight coughing, but no fever or anything like that. I decided if I feel sick when I wake up, I'll call 311 just to get more information about getting tested. Because the thing is, I think if I were to get coronavirus or whatever, I'd be fine. But I have plenty of friends and family who are either older or have, immunodeficiency issue, whatever. I don't want to pass it along to anyone. And so I called 311 just to see how I should go about getting tested or whatever. I called 311 and they were like, well, you're exhibiting all of these really serious symptoms and you were traveling. We want to patch you through to 911. And I was like, no, I don't think that's necessary. I don't have the money to pay for ambulance or whatever. And they were like, no, they'll just talk to you, whatever. Okay. So I talked to 911 and they told me, based on your symptoms, as well as the fact that you're traveling, we need to come pick you up in an ambulance. And I didn't want to be picked up because I think most people know that ambulance rides cost thousands of dollars, even if you have insurance, which I do, which is great and I'm very thankful for, but it's not it's not always the best. It doesn't cover everything. And so they said, and I was like, can I just come in a car or, whatever? And they were like, no, you can't come in a car. You could infect your Uber driver, and you obviously can't come on a train or a bus. I wouldn't have done that anyway. And they're like, so we need to send an ambulance. And again, I said, I really don't want to. I can't afford that. And they're like, this is a matter of public health. So we need to pick you up in an ambulance. And they were there within 10 minutes or less. I met them downstairs and got in the ambulance. So I got in the ambulance. I was talking to the two EMTs that were, there and helping me out, and they were great, really, really awesome people. And I was telling them, they were asking about my symptoms, and I was like, look, I really don't think I have coronavirus. I just think I have the flu. I just wanted to get more information. And then before I knew it, I was told I have to be sent to the hospital. And they were like, look, it's okay. What we have to do now is we call the Department of Health as well as a local coronavirus doctor, and they need to sign off on if you are even allowed to come in and get tested. And they were like, honestly, there was a lady yesterday who had worse symptoms than you that they didn't let come in, so just because we're here doesn't mean you'll have to go to the hospital. Okay? And so I was like, okay, so let's, whatever, I'm letting them be in control. Okay, so we proceed to wait for an hour to talk to the New York Department of Health. Or they do. I'm just sitting there on my phone playing like Candy Crush and telling my mom what's going on and my friends. We were sitting in the ambulance on my street in front of my apartment building for an hour while, we got clearance for me to be allowed to come to the hospital to get tested. It's basically, they want to rule out anyone who, is being, a worrywart or who doesn't actually have symptoms. So at any moment, I was like, okay, they're not going to bring me to the hospital, whatever. I'll get out of this ambulance soon. However, they decided after an hour, that I should come into the hospital. They really wanted me to get tested. Okay. So we ride to the nearest hospital, and we pulled up to the hospital. They wouldn't let me get out until, basically every one of the nurses here had to put on protective gear. The EMTs who were helping me out also had protective gear. And this whole time, I'm like, I don't think I have coronavirus. But, look, Tom Hanks just found out he has it, and he was barely sick at all. So I was like, fuck, I have to do this to protect other people. Okay. So I'm escorted into this lovely room that is like a plastic cage with, plastic doors and a really weird bathroom. And There were no pillows or blankets on the bed. I was just kind of put in here, and I didn't even know I was allowed to sit on the bed because it was such an abrupt, like, putting me in here like a dirty person, that I was just standing there for 10 minutes before someone was like, you know, you can sit down. I was like, oh, okay, I didn't know. And I've been in this room now for, I think, 4 hours. 4 hours, yeah. I asked someone outside, you know, like in the reception area. I was like, I motioned them to come over, and I was like, hi, do you mind if I have like a pillow and a blanket? And they were like, yeah, sure, we don't have any pillows, we can bring you some sheets. 2 hours went by, I didn't hear anything, and so the doctor came in and she swabbed my mouth and swabbed my nose, didn't tell me what it was for, and left. I assumed she was testing for corona. I don't really know. And it wasn't until an hour and a half later when the nurse came in and was continuing to take blood where I was like, do we know when I'll get the results back for coronavirus? And she said, I don't think they're taking it. That was just a flu test. And I was like, what? So I told her, I was like, from the beginning I've said I don't want to come in. I don't think I have coronavirus, but I was forced to come in. Not only that, but in an ambulance, which I cannot afford. If I'm here, I want to be tested for corona, because that was the whole point. I was forced to come here. And I told her straight up, I said, I can have the flu at home. I can suffer through that. And she was like, do you want me to bring the doctor in so you can talk to her? And I said, yes, I would like to talk to her. And so a minute later, the doctor comes storming in. She's clearly pissed that I want to talk to her. And she's like, I hear you want to talk to me. And I said, yes, you know, like, I was forced to come here because multiple healthcare professionals thought that I needed to be tested, as well as, you know, the New York State Department of Health, whatever it's called. And I went through all of these things, and I didn't want to come here, and I made that very clear, but I was forced to because I was told I'm very high risk and I need to be tested. And she was like, well, ultimately you don't fit in with the protocols. And I was like, but how does that make sense? Like, people are still carriers, and why would I be sent here to be tested if, like, these 5 other people that already approved it don't think it's important? At the same time, this doctor's coming in to give me a chest x-ray, and the doctor's like yelling at me, and I said, wait, no, what is this chest x-ray for? If I'm not getting tested for corona, why am I getting a chest x-ray? And they were like, oh, we need to rule out pneumonia. And I told them, I'm pretty sure I don't have pneumonia. I'm barely coughing. My chest hurts a little bit. Those weren't my symptoms for coming in. So now I'm going to be saddled with thousands of dollars in medical bills just because I have the flu.